So with that, let's talk about solving healthcare. Now, I started off this presentation today talking about those of you who support single-payer healthcare. As you all know, I'm a huge advocate of single-payer healthcare. And in my healthcare plan, I have multiple things in there, provisions in there, ideas that will not only accelerate Medicare for all, but it improves the quality of care and lowers the cost of care. So I want to talk about some ideas, and I've kind of split them up into several points, and we'll go through them one at a time. So first of all, right now in the United States, we are paying somewhere around $4 trillion for healthcare. That's a number that has been verified by multiple sources. So you can go to cms.gov, which is a government source, and of course you can go to many non-government source. Google for the cost of healthcare. So today we are paying around $4 trillion, maybe a little bit over $4 trillion for healthcare for everybody in this country. Now that still leaves out close to 30 million people that have no health insurance whatsoever. So their ability to get health care is very limited. It's very limited, if none. And of course, there are millions of people, close to 60, 70 million people, that even though they have health insurance, they do not have the ability to actually get health care. So that is where the cost of health care is right now. Now I want to talk about health insurance premiums. So right now, there are two or three ways you can get healthcare. If you are under 65, you would either get healthcare through your employer. It's almost always tied to your employment and full-time employment at that. And your employer may pay for some of those premiums to help you out. So your premiums are lower than what they would be if you paid straight out of pocket and bought that health insurance plan off the market. The second way that you might get a health insurance is through healthcare.gov, also known as the Affordable Care Act, where if you are self-employed, let's say you're a realtor or you're a small business owner or you're an entrepreneur, you would go to healthcare.gov, and that is one way that you could purchase health insurance, which is very similar to purchasing health insurance privately off of the market without going to healthcare.gov. The only reason that you would go to healthcare.gov is to see if you qualified for some federal assistance. Now, in Texas, they did not, it's one of the states that did not expand Medicaid. So the only help that we have is through the ACA subsidies. So what are ACA subsidies? ACA subsidies are very similar to if your employer paid some portion of your healthcare premium per month. So everybody has a premium per month, and then if your income is low, the federal government may pay some of that healthcare insurance premium. Now, that doesn't mean that health insurance companies get less. Remember, health insurance companies get the full amount that they are supposed to get. So they don't lose a single penny of that amount. So that's important to keep in mind. So that's what health insurance premiums are all about. Now, I wanted to bring a real example to you. So I went into healthcare.gov and I pulled up, a plan that you could get for something around $400 a month. So your premium would be $400 a month. Now, depending on your income, this is what's called a bronze plan. But depending on your income, the ACA would pay some portion of it. So you may only pay $200 of that $400, or you may pay only $300, or you may pay even less depending on what your income is. It's on a sliding scale, right? So that $400, regardless of what your income is, the United States government pays that to health insurance companies no matter what. And so ask yourself this: for the premium that you pay, what do you get in terms of healthcare coverage? Now, there are some basic things you get, but there also comes with a deductible. So I looked on that same bronze plan here in Austin, Texas, and the deductible is over $7,000. That means for any kind of major medical needs, you would have to basically be basically pay that $7,000 out of pocket before your insurance kicked in. And I'll give you an example. If you wanted to have a child, they did a little bit of a math. They did, slight math there to show you that you would pay somewhere around, $8,500, because after you meet your deductible, there's also something called coinsurance. So your deductible is met, so now your insurance kicks in, but then you usually have a coinsurance of anywhere between 20% to 30% to 40%. So this specific plan had a 30% coinsurance. So you can see here that even if health insurance premiums are subsidized, there's a lot of expense that people on the Affordable Care Act have to pay for. So people who are on private health insurance, who have been consistently employed and have never had to go without health insurance, for them, it's very difficult to understand what the cost of healthcare is for someone who's an entrepreneur or self-employed, and pay for their own health premiums. Or if you're just low income and your work doesn't cover health insurance, if you're a part-time worker, let's say you work retail and you can't get a full-time job, or you're working 3 part-time jobs, so you're working over 40 hours a week, maybe you're working 60, 70, 90 hours a week, but your healthcare is subsidized by the United States government through Affordable Care Act, but you still really can't go see a doctor because your deductible is $7,000. Now, that's one of the reasonable plans. Of course, there are areas where the deductible is $10,000, or it could be, even more than that. So that's what we talk about. Solving for health insurance premiums, like the Build Back Better Act doesn't help people actually get health care. So that's the second problem that I want to bring to you. The third problem with either the public option or even Medicare for All is that right now in the United States, we have a shortage of physicians. So there's an estimate of anywhere between shortage of physicians of 50,000 to over 150,000 shortage of physicians in the United States over the next 10 to 15 years. But right now in the United States, we have over 90,000 physicians that were educated and trained outside the United States, and they practice here because we have a shortage of physicians. We really just need doctors. That is something that is not addressed by Medicare for All. And until we meet this shortage of physicians, we cannot lower the cost of healthcare. Because if we want to bring on the other 30 million people that today do not have any health insurance and hence probably have absolutely no ability to get healthcare, if they wanted to go see a doctor, we would need to fulfill that need, and we have a shortage of physicians already. So that's one of the things that I talk about, that if we really want to accelerate Medicare for All, we have to address the shortage of physicians. The second thing I want to talk about is primary care. We not only have a shortage of physicians in general, we also have a huge shortage of primary care physicians. And because we don't make primary care available to everybody in the United States readily and in an inexpensive way, we raise the cost of healthcare in a significant way. And a real simple example is, if you don't have health insurance or if you have a high deductible, you may not get all the tests that you need. Now, if you have any kind of health insurance in the United States that is bought through the Affordable Care Act or healthcare.gov, it covers an annual checkup. So they run some blood tests. They are able to, check you out. You go and see the doctor, and they can do a basic screening. Now, this basic screening does not cover all kinds of other types of screening necessarily. Some of the screening is covered, once in 2 years, once in 5 years, once in 10 years. Other screening is not covered at all. So by not giving people the ability to go see a primary care physician easily and very inexpensive, meaning bringing down the cost where it's negligible, what we're doing is we're raising the cost of healthcare in our country. Because let's say you have a small tumor and you don't know about it until it's in second or third stage, and now all of a sudden you have to get chemo, and you've caught it very late into the prognosis of whatever you have. So now you have increased the cost of that healthcare significantly, and that goes with all kinds of chronic health diseases that are caught much later instead of catching them early. Now, if people had the ability to go see a primary care physician easily, inexpensive, negligible expense with respect to their income, we would lower the cost of healthcare significantly. So one of the things that I call for in my healthcare plan is increasing the number of primary care physicians in a significant way and making it readily available to every single person in our country. That alone would lower the cost of healthcare significantly. It would not only do that, but it would cover the majority of challenges that people face being able to go see a primary care physician on a regular basis. So there's two things. There's a physician shortage, there's a primary care physician shortage. So both these specific shortages need to be addressed for us to be able to actually lower the cost of healthcare and improve the quality of care. Now, the third thing that I talked to a lot about, and I left this until I talked about the physician shortage so you would understand, is scaling the healthcare infrastructure. Now, what does scaling the healthcare infrastructure mean? So today, one of the things that we have in our country is that healthcare is a profitable business. So if a hospital is not running well, what happens is they shut down. So to give you an example, here's what I did. I went to Google and I did a quick search of rural hospitals, and I clicked on the news part of Google. And these are the stories that came up. And I don't know if you can see this, but I'm going to read the headlines to you. The first headline is, "See how many rural hospitals in South Dakota have closed." That's 15 hours ago. Missouri is the number 8 state with the most rural hospital closures. The next title is, "Tennessee is the number 2 state with the most rural hospital closures." And then California is the number 4 state with the most rural hospital closures. Kansas is the number 1 state with the most rural hospital closures. And last but not the least, 181 rural hospitals have closed since 2005. See the states. So what do you think happened after I went through all of these links? In my mind, the one I wanted to know really badly was, well, what's the number 1 state where the most rural hospitals have closed? And guess what I found? Texas. Texas is the number 1 state where the most number of rural hospitals have closed. And why is that? Because rural hospitals have a hard time being profitable. Because they can't make a profit, they shut down, basically stranding up to 57 million Americans who live in rural parts of our country and putting them in a position where they have absolutely no ability to get health care. That is the state of our country today. So why am I talking about scaling the healthcare infrastructure? Many people love single-payer healthcare because they say it actually, and if you didn't know this, it keeps providers, that means hospitals, physicians, offices, clinics, places where you go to get testing done or imaging done. It keeps all of these providers 100% private. All it does is eliminates health insurance companies and makes the United States government the health insurance company. So single-payer healthcare does not mean the United States government is administrating your healthcare. They're not. All they're doing is being the one place where instead of paying premiums of hundreds and thousands of dollars, in fact, tens of thousands of dollars per family in healthcare premiums to multiple health insurance companies, the United States government acts as the one health insurance company. That's why it's called single payer. So instead of giving them money and saying, oh, I'm paying them every month because of that one day I may end up with needing to get chemotherapy for cancer or address a chronic disease, etc., etc., the United States government becomes your one-stop shop for health insurance. They become the insurer. That's all it is. But it does not address things like rural hospitals. So what would really have to happen in order for these 57 million people in our country that live in the most rural places in the United States to be able to get health care? They would need clinics and hospitals in these rural areas in order to actually give them health care. And many of these providers may have to run at a loss. And this is where scaling the infrastructure is very important, that we not only have to ensure that we get healthcare to people in urban areas where it's supposed to be readily available, but in order for us to get healthcare to people in rural areas, the government may need to subsidize some of those providers, or even be able to provide, government-run, institutions in those specific areas where they cannot get a private provider to provide healthcare at a profit. So you see where I'm going with this, that scaling the healthcare is just part of that. The second part of scaling the healthcare is what I talked about, that if we don't have enough primary care physicians and primary care facilities, being able to just walk down to the end of your neighborhood and go see a doctor on a regular basis without checking if they're in network, out of network, etc., that is also scaling the healthcare infrastructure. But it doesn't end there. We also have a huge deficiency of nurses and nursing care in this country, and other healthcare professionals, technologists that work in doctors' offices, etc. So until we scale the healthcare infrastructure, whether it's Medicare for all or even a public option, none of these specific solutions will actually not be successful. So in order to accelerate Medicare for all or single payer healthcare, we must scale the healthcare infrastructure. We must address the fact that healthcare is not readily available in rural areas of the United States, 57 million of them. And third, that we have a huge shortage of medical professionals, whether it's primary care physicians in general, with specialties, and other medical providers and nurses and PAs, etc. That is the most important thing, that until we scale the healthcare infrastructure to cover all of those, we will not lower the cost of healthcare. And remember, we are overpaying for healthcare. So those of you who always say, well, Donna, how are you going to pay for it? Well, we're paying $4 trillion for something that should cost us less than $2 trillion. So where is all of that excess going? Well, think about it. For a family of four, you probably pay somewhere around $2,000, if not higher than $2,000 premium per month. Where does that money go? Because if you don't get any healthcare that year, all those premiums just go to that health insurance company. They're not paying anybody for anything, for any kind of care. So there is at least $2 trillion that all of us are collectively paying to get zero services. That's where we are, and that's why just going to Medicare for all or public option will not solve our high healthcare costs and improving the quality of care and making sure that everyone has the ability to go see a doctor when they get sick. So now let's talk about public option. Many of you are really, really worried about losing private healthcare and would rather like to see private health insurance, not healthcare, rather, losing private health insurance. And you want to see private health insurance in addition, in parallel with public option. I want to explain to you the problem with why public option doesn't work. If the United States government offered a public option, then private health insurance companies will create regulation or criteria to basically create a way to make it impossible for you to purchase private health insurance. It will by making it too expensive for you to purchase it if you are sick. So even if you, let's say, for example, get your insurance through a employer, private health insurance companies can go to the employer and say, you know what, we'll insure all the people in your company that are healthy, that are, under 50 years old. We'll insure all the men under 50 years old, and any woman who is of age to be able to give birth, they're excluded because we know that's going to be expensive. Okay. Anybody who's really ill, they're excluded, but we'll cover everybody else. So what does that do? It maximizes the profit for the private health insurance companies while loading the sickest people, the most vulnerable sick people that have high healthcare costs onto the government. And so it raises the cost for all of us, including those that are healthy, in the long run to pay for healthcare. And that is why public option in parallel with private health insurance does not work. So for those of you who are fans of public option, need to realize that all it will do is increase the cost of healthcare for the United States government, and that means increasing the cost of healthcare for all of us, even if you're a healthy person. So that's why single-payer healthcare is the only solution. But in addition to that, the government will need to subsidize, if we want to subsidize the cost of care for rural United States. Because as I showed you, almost everybody every state has incurred some closures of rural hospitals, rural clinics, and rural, just being able to go see a doctor in a rural area. The last point I want to talk to you is about dental care. As you know, vision, dental, and hearing are not covered in most health insurance plans. So if you get private health insurance through your employer, they might give you a dental care option, or they might give you a vision care option or a hearing option, but they're usually separate insurance other than your health insurance. Now, in the Build Back Better plan, one of the provisions in there was to cover dental and hearing and vision for Medicare recipients. So people 65 and older in the United States have the option to purchase Medicare with the government, which is a single payer healthcare option, but it's only for people over 65 and older. Now, here's the thing that most people don't realize, that even with dental insurance, even if you're paying a premium for dental insurance, the biggest challenge with dental is that the cost of dental care is extremely high in the United States because the whole industry is privatized, and there's absolutely no way to basically compare to understand what the cost of something is. You can't go to 5 dental offices and say, hey, what's the cost of your crown and your crown and your crown and your crown? Because every single dental office will say, well, you need to come in, we need to do an exam, and we need to take our own x-rays. And so they cost money. So it'll cost, somewhere between $300 to $400 to $500 to do an exam and give you an estimate of what it will cost. Now, your health insurance, your dental health insurance, does not pay for you to go compare. So you can't go to somebody's website, a dentist's website, and say, well, what does a crown cost for you, dentist A versus dentist B, and make an assessment. And on top of that, even with dental insurance, the cost of dental care is through the roof. We're talking about $5,000, $6,000, $7,000. We're talking about if you need a root canal or a crown or an implant, they're extremely expensive. Implants can cost up to $10,000 if you need grafting, for example, if you need to graft a bone into your teeth. And these are the challenges that we are not addressing the cost. So you can complain about healthcare and ask the United States government to cover healthcare and go to single-payer healthcare or Medicare for all, or even the public option. But as you can see, that if you don't lower the cost of healthcare and you don't scale the healthcare infrastructure and address those two issues, you cannot solve healthcare. So what it's really going to take to solve healthcare are those two things, including being able to have this interest in wanting to solve healthcare. Why does the United States government not want to solve healthcare? It's difficult to say, but what I can tell you is that if we solved healthcare, we would see an extreme improvement in entrepreneurship, on starting new businesses. It would be really great for almost any business, including, multi-billion-dollar corporations wouldn't have to worry about, administering health insurance plans for their tens of thousands of employees. It will really give working people power. So it goes back to unionization, that unions have to exist today because the basic person who's working does not have these basic rights to go negotiate with their employer. And health insurance and healthcare have absolutely no business being tied to employment, because as we know that it is very easy to be unemployed, it is very easy to be in between jobs, and no one can predict when you would have a health emergency. So this is why single-payer healthcare is not just great for our economy, for lowering the cost of healthcare, for making sure that we get care to everybody, but for improving the quality of care. But in addition, it is good for our economy, and it is a great way to actually let our country flourish. So with that, that is a intro primer to healthcare. I will bring more data and facts in a hopefully future transmission. But with that, I want to thank you so much for watching my live stream today. And